Hello students, I will show you today an important surgical instrument which is very essential, the instrument for tissue approximation. Whatever the tissue approximation, just see that tissue approximation instrument. So what this instrument is, look at that, finger bows, proximal this one, this part. What is this instrument is? It is needle holder or needle driver. Some countries, including India, we call needle holder. Some countries they call the needle driver. Both are same. Remember, what are the features? It has got a long proximal blade. I had already told. Stout, short distal blade. It's a very stout, short distal blade. Distal blades have got crisscross serrations, often with the grooves. There is a groove in between. There is a blade. There is a groove in the blade inside, and crisscross serrations are there. And what are the uses? It is used to place needle between the distal jaw, distal blades of the distal jaw, and place it usually between the proximal 2/3 and distal 1/3. So they would always lock it while using for tissue approximation, to pass through the needle in any tissue approximation, maybe vascular, maybe skin, maybe soft tissue, maybe muscle, maybe whatever it is. So very essential instrument. The instrument for tissue approximation is needle holder, small size available, curved available, long one is available, fine one is available, ophthalmic sutures, fine suture instruments are available with the, like this fine movements you can do. Otherwise, usually this needle holder, laparoscopic needle holders are available. Different needle holders are available for surgical use during tissue approximation, so that with the needle and needle you can pass through the tissue, so that material is passed to approximate the tissue after placing the knot. As such, so these are the uses: curved needle, tissue approximation, proximal 1/2 and distal 1/3. Like this you have to place needle, and you have to always lock. Then rotation movement, not pushing. Fine, precise rotation movement. These two fingers should be used to hold, ring finger and thumb, not other fingers while holding the needle holder. And in the rotation movement, use it. See that blade? You can you can see that distal blade. There is a groove here inside, and crisscross serrations, and there is a groove here. Groove is there. That's very important, so that needle won't rotate after locking. It won't snap. So grip, firm, precision, and firm grip is very essential. Grip and precision, both things are very essential while using doing tissue approximation using needle, especially laparoscopic. Dexterity is very important. Focused work, it's very focused work important. Remember. So please go through my SRB clinical methods in surgery for clinical examination, my manual for detailed test about the different all surgical topics, operative surgery book, both volumes in detail, procedures is there with the illustrations and photos, and atlas of tissue approximation. It is a current needle holder. What I am discussing is very useful. Same thing is shown very nicely, expressed very nicely in detail, 100 pages atlas with the important thing, additional corresponding video lectures of how to do it. Suturing, that is very useful. Please go through that. It gives a clear idea of tissue approximation with all principles. And my DigiNow lectures is very popular. All surgery topics are covered for CBME, UGs, operative procedure, specimens, X-rays, and specialties, urology, neurosurgery, cardiothoracic, all topics covered in detail. Useful. Please subscribe for a year, both for finally UGs, undergraduates, and postgraduates also. It is very useful. So student needle holder or needle driver is very essential instrument for tissue approximation. You should know how to hold it, everything. Please go through my video lectures, operative surgery, tissue approximation book. You will have the clear idea. I hope you have understood this lecture very well. Thank you very much.